Hello, my name is Dr. Dewan S. Raja. Today I will solve a few multiple choice questions in head and neck anatomy from question number 36 to 50. I will add all the links of the relevant books in the description bar of my video. So let's start our questions from the very beginning. Question number 36. The carotid sinus is located at the termination of the common carotid artery or at the beginning of the internal carotid artery. The carotid sinus acts as a baroreceptor's site to regulate blood pressure. We have two carotid sinus, one on each side. Which of the following cranial nerve carries sensory information? There is the afferent information from the baroreceptor. Answer should be what? Hypoglossal nerve, accessory nerve, answer cervicalis nerve, glossopharyngeal nerve. What is the answer? Answer is glossopharyngeal nerve or ninth cranial nerve. Okay. Question number 37. External jugular vein is formed by what two veins? Transverse cervical vein and anterior jugular vein, suprascapular vein and anterior jugular vein, posterior auricular vein and anterior division of the retromandibular vein, posterior auricular vein and the posterior division of the retromandibular vein. What two veins unite to form the external jugular vein? Answer should be the posterior auricular vein and the posterior division of the retromandibular vein. Okay, so this is an image. I have taken it from Atlas of Anatomy and Gilroy, first edition. Identify the indicated opening, green area. This is an opening. This is opening for the pharyngeal opening of the pharyngotympanic tube or pharyngeal opening of the eustachian tube. That is this. This green is this. This is the torus tiberius and this is the salpingopharyngeal fold. Okay, so identify the indicated opening. This green area, there is a depression, communication from the nasopharynx to the middle ear cavity via the eustachian tube, also called auditory tube, also called pharyngotympanic tube. This is not superior meatus. This is not middle meatus. It is not inferior meatus. It is not the sphenoethmoidal recess. Okay, and that is not nasolacrimal duct that opens into the inferior meatus of the nose. So our answer should be eustachian tube. You can say the nasopharyngeal opening of the eustachian tube. Eustachian tube is also called auditory tube, also called the pharyngotympanic tube. Okay, so we got 37, 38, then we got 39. Okay, 39, identify the indicated red structure. What is the red structure? Okay, what is this? Is it nasal septum, inferior concha, maxillary sinus, hard palate, soft palate? Answer should be what? Inferior concha. Okay, we got that. So we got the carotid sinus, we got external jugular vein, we got the eustachian tube opening. Okay, then we found the inferior concha. Inferior concha is also called inferior turbinate. Turbinate and concha are interchangeable words. Okay, we got the 39. Then we'll go to the 40. Okay, 39, our answer is inferior concha. Then we'll go to the question number 40. The carotid body is a small P-shaped structure, acts as a chemoreceptor and is innervated by the vagus nerve and glossopharyngeal nerve. Okay, that is the answer, vagus nerve and glossopharyngeal nerve. Following a road traffic accident, we'll add the word a. Okay, following a road traffic accident. Okay, a 34-year-old man has developed significant weakness to turn the head to the left side and inability to shrug his left shoulder. Which of the following nerve is most likely injured in this patient? Answer should be left spinal accessory nerve that supplies both the sternocleidomastoid muscle and the trapezius. Okay. Then we go to the question number 42. A surgeon was trying to remember the contents inside the parotid gland prior to removing a benign parotid tumor. All of the following structures passes through the parotid gland except one. The exception is what? External carotid artery, yes, it passes. Rectomedullary vein is formed there. Terminal branches of the facial nerve are within the parotid gland. Facial artery, is it? No. Facial artery is not. External jugular vein, initial part is deep to the, it is within the lower part of the parotid gland. So we got that. Answer should be C. A surgeon was trying to remember the content. Okay, so we got 42. Answer is, what is that? Okay, so here answer is the left spinal accessory nerve. We'll go to the question number 42. Following a road traffic accident, what happened? Person cannot turn the left head, so his problem is the left spinal accessory nerve. Okay, we got left spinal accessory nerve, question number 42. Let's go to question number 43. A 32-year-old man with chronic maxillary sinusitis has developed pain over the skin between the lower eyelid and the upper lid. Which of the following nerve innervates both the sinus means maxillary sinus, and the skin? Facial nerve, auriculotemporal nerve, infraorbital nerve, supratrochlear nerve, supraorbital nerve. What would be the answer? Answer should be the infraorbital nerve, C. Okay, we got the C. Then purulent discharge from the infected maxillary sinus is drained into the nasal cavity via the what? Via the middle meatus. B is the answer. Okay, so we got B, middle meatus. That is the answer. Okay, this is the middle meatus. Okay, this is the answer. Okay, then we'll go to question number 45. Pituitary adenoma is very common tumor, is surgically removed through which perineal sinuses? Frontal sinus, maxillary sinus, posterior ethmoidal cells, sphenoidal sinus. Answer should be what? Sphenoidal sinus. It is approach to the nose. Sphenoid bone is broken to get the pituitary gland out. Okay, so we got that. We got the sphenoidal sinus. D is the answer, 45D. Then we'll go to the 46. During a physical examination for cranial nerves, an ENT, ear, nose, and throat doctor asked his patient to stick out the tongue. Which of the following cranial nerve action is essential for sticking out of the tongue? Okay, tongue sticking out by means of the action of the hypoglossal nerve. Okay, that is answer E, 46. Okay, we got that. Then 47, during a routine examination, a dentist asked her patient to protrude the tongue forward. The tongue was deviated towards the left. The patient could not put it in the midline, the tip, It is deviated towards the left. Which of the following cranial nerve lesion is associated with deviation of the tongue towards the left? Answer should be left hypoglossal nerve. Okay, because there is no resistance on the left side, so right sided part muscle will push towards the left side. Okay, we got 47. Answer should be left hypoglossal nerve C. Then we'll go to the 48. All of the muscles in the tongue are innervated by the hypoglossal nerve with one exception. The exception is what? Genioglossus, hyoglossus, chondroglossus, styloglossus, palatoglossus. What is the exception? Exception is palatoglossus, E. Okay, we got that. Then we'll go to question number 49, which is a 39-year-old woman was accompanied by her husband to a dentist office due to bruxism, teeth clenching, specifically at the night time during sleep. On examination, the dentist found a distinct muscular hypertrophy over the mandible. Which of the following muscle might undergo hypertrophy because of bruxism? Okay, undergo hypertrophy over the mandible, that should be the masseter muscle. This is the answer, masseter, 49B. Okay, then we'll go to here. A teenage girl pricked an acne over the nose. A few days later, she became comatose due to cavernous sinus thrombosis. The infection from nose reached the cavernous sinus via what? Maxillary vein, superior ophthalmic vein, internal jugular vein, diploic vein, retromandibular vein. What is the answer? Answer should be B. That is the superior ophthalmic vein. Okay. The postsynaptic, or you can say postganglionic parasympathetic fiber are conveyed from the otic ganglion to the parotid gland by what? By the auriculotemporal nerve. The external jugular vein opens into where? Subclavian vein, internal jugular vein, facial vein, brachiocephalic vein. Answer should be subclavian vein. Okay. And that's all about the multiple choice question in head and neck anatomy from 36 to 50. I will write the name of the specific book which I follow, as well as my MCQ book on anatomy. I have around 1870 MCQs. If you are interested, you can collect those books from Amazon. So have a nice day. Bye now. Please share the information with your friends and please support my channel. Please subscribe me. And again, have a nice day. Bye.